My name is David Tourgeman. I'm a physician at Huntington Reproductive Center in West Los Angeles and Encino, California. And I'm a board-certified reproductive endocrinologist and infertility specialist. Typically, we want to screen our patients to make sure that they are psychologically fit to be parents. And I think that's the most important underlying aspect of all of this. Within that, there may be particular demographic issues that become important. For example, you mentioned age. Age is indeed an issue if both parents are, let's say, 65, 70 years old. It's really going to make you question about their longevity, their intent. Why is this so important at this age? And so typically we will use 55 as a rule of thumb for a patient to use her own uterus. If there is, I would like to say that there are medical reasons to not want to go beyond that point. There are probably an additional 5-10 years in which we can consider using a gestational carrier for an intended couple, but far beyond that, you really start to question the reasoning for desiring to conceive. As far as sexual orientation, I really don't think that that is a viable option to not allow couples to conceive or have children. As far as same-sex couples are concerned, we are absolutely open to helping that situation. For the most part, we will often and easily consider a single woman and allow them to conceive with sperm donation, and similarly, we should consider that option in single men. We screen our patients psychologically, at least initially, by simply speaking with them. If indeed they're using gestational surrogacy or egg donation, we typically also send them to a professional psychologist for evaluation. Most families will indeed do most of their homework at home. They will book their trip and find either a hotel or a house in which to stay at. Some may very well have acquaintances or friends that are already here. And so often we find that the couples will have already made all the arrangements on their own. It's not uncommon to have a referring doctor from an outside fertility center refer the patient. In fact, we see that more and more frequently where egg donation, for example, needs to be done on an altruistic basis. And oftentimes that's not available, so the infertility doctor, once they have exhausted their possibilities, will be able to refer that patient here for anonymous egg donation. And in that scenario, then there's absolute communication between myself, their physician, and the patients. If surrogacy and or egg donation is illegal in their particular country, they often do not want to involve their physician at home. However, they can certainly say that without disclosing what they are doing, we would like an ultrasound for the measurement of follicles or whatever it is, the lining of the uterus that we want to evaluate. Oftentimes, couples will purchase the medications in their home country simply because they will be able to significantly save on the cost of the medications. On the other hand, couples that are in the United States don't typically get advocated to purchase the medications from abroad, simply because the excursions of temperature may have a mal effect on the viability of the medication.